is a major step towards getting a COVID vaccine for the younger kids. Pfizer has asked the FDA for emergency authorization to give its vaccine to children ages 5 to 11. This comes amid an uptick in cases among kids of all ages since the return to the classrooms. Now, this week, we told you about an entire fifth grade class in Centennial having to quarantine after being exposed on a class trip. CBS 4's Marissa Armas with more tonight on why getting the vaccine to more age groups is crucial.
Schools in Colorado make up nearly 1/3 of COVID outbreaks. Earlier this week, parents at Willow Creek Elementary learned of an outbreak at the school after the entire fifth grade class was exposed during a class trip. And on Wednesday, a similar situation at Lenski Elementary in Littleton. District officials telling CBS 4 it's a kindergarten class at the school. They'll learn remotely for at least 10 days. But with Pfizer and BioNTech officially asking the U.S. for FDA authorization of its vaccine for kids ages 5 to 11, is this going to help with what we're seeing at schools?
Well, this is good news because this will put another tool in our toolbox for fighting the COVID pandemic. It's not a cure-all, it's just another tool that we can use.
Dr. Reginald Washington says even if the FDA approves the vaccine for kids, that doesn't mean we won't still see outbreaks.
Because we don't know how many kids are going to actually take the vaccine. We know in the 12 to 18 age group, it's still only about 40 to 50% of kids are actually receiving the vaccine.
Dr. Washington says no matter what age group gets approval for the vaccine, the longer COVID-19 is around in any age group, the more likely the virus will continue to mutate.
And so the sooner we can get it out of all communities, the better off we're going to be.
Dr. Washington says that FDA approval likely won't come until the end of October. He says that kids will likely need booster shots in the future. In Denver, Marissa Armas covering Colorado First.